Kia ora, my name's Hannah. When a person suffers a cardiac arrest or their heart stops beating, paramedics assess airway, breathing and circulation. They'll start chest compressions, assess the electrical rhythm and determine if this can be shocked using a defibrillator. They'll also administer medications and then repeat this process. In cardiac arrest, the heart rhythm is either receptive to a defibrillator shock or it is not. The non-shockable rhythm of pulseless electrical activity, or PEA for short, is what my research is interested in. PEA is when the heart muscle is not beating, but the electrical conduction that would normally stimulate that heart to beat is still firing, producing a rhythm on the monitor. Because this rhythm looks like it should produce a pulse, we need to manually check it and see if there's a heartbeat. If there's no pulse, we continue CPR, chest compressions, and this is termed true pulseless electrical activity. The problem with the pulse check is that the absence of a pulse does not always indicate true pulselessness in profoundly shocked patients. The heart may not be strong enough to generate enough blood pressure to create a palpable pulse. And the pulse check, even in the hands of health professionals, is not accurate. And we're using this non-upgradable antiquated technology to identify shocked, poorly squeezing hearts which can't even create a pulse. And this is called pseudo-PEA. In pseudo-PEA, instead of resuscitation being attempted, the patient may prematurely be declared dead. And research reveals that up to 75% of patients in PEA have a heartbeat when examined with an ultrasound, further exemplifying the importance of ultrasound integration into cardiac arrest for PEA. What are the benefits? To physically see the heart, whether it's beating or not, to look for reversible causes of cardiac arrest, such as low blood pressure, and the ability to tailor treatment and see the effects of that treatment real time on the ultrasound image. So what's the problem? Why are we not already using ultrasound? Well, there's a distinct lack of good quality literature in the pre-hospital setting, and the ultrasound is said to prolong that pulse check pause, which should take less than 10 seconds. And delays in the pulse check may mean delays in chest compressions, which we do know is detrimental to patient outcome. My research question is, can paramedics acquire and interpret cardiac arrest focused echo during the pulse check pauses in PEA at simulated cardiac arrests? To answer this question, the research investigated if paramedics can learn ultrasound and then safely integrate this into that 10-second pulse check pause window. How did we do this? We recruited 30 paramedics, provided them with education, face-to-face hands-on training, and then assessed them over 3 months. What the preliminary results show is that paramedics can learn heart ultrasound, and that if you keep the ultrasound paramedic supernumerary and pre-image the heart during CPR before that pulse check pause commences, we can adhere to that safe time frame of 10 seconds. Thank you.